been working in health for a few years now, and I'm noticing a steady increase in cases of negligence, harm, poor practice, incorrect diagnoses, overdiagnosis, overprescription, underprescription, shonky advice, no informed consent, people with chronic health conditions that would not have existed if it had not been for a competent healthcare worker. Just, I could go on. I could go on and on and on. I could make a video about every single one, but this video I'm going to concentrate on. I'm going to concentrate on Aboriginal healthcare because that is my one of my interests, and that is what I do for my career, and I'm still in there learning as I go, and observing and witnessing what is happening from a perspective of a human woman, and also as a health worker and carer. Like, I grew up in New Zealand, and most, like, from people my age in their 30s would have grown up with quite a sound kind of understanding of Māori culture and language and customs, and just took it for granted, but like, we deserve to. And even we in New Zealand will say that it's just not good enough how we are treated, with the discrimination and the bias and the poor health outcomes and other issues, social determinants of health and things like that. We don't think it's good enough how we're treated in health, in education, in every sector. And coming from that kind of background and environment, coming to this country in Australia, and seeing what is happening with the Aboriginal people here in this country, and I can tell you that from my point of view, it's horrific and actually quite traumatizing to see and witness and be around and work in. Not just Aboriginal men, not just Aboriginal children, not just Aboriginal elderly, all Aboriginal people in every system, health, justice, education, all of them. I only know so much from a portion of health. Aged care predominantly, just from what I'm seeing, is that, and I thought that leaving the facilities, I wouldn't see this as much or at all or as frequently, but the negligence and incompetence of not just individual health workers or support workers or managers or things, the incompetence of the individual, plus the incompetence on the organisational level, systemic level, the incompetency on that front. And then as we move up, the incompetency of the people who run these organisations, as not-for-profit and community-based government-funded programs and health initiatives that are like seriously mismanaged and underfunded, and not funded probably in the best way. Or anyway, I'm not an expert in that sector. This is just from what I've observed. There's incompetency on that level, and not just competency, but you start to get to the corruption level, like mid-high white collar stuff. And then the people on top of that make the policies I've jumped up about 10 levels between there, but you can just see the fact that the levels are becoming more increasingly stacked and compartmentalized, and we're getting to like fine print level, Aged Care Act policy framework type level people here. I haven't worked in that, but from what I can see, there's a lot of like all talk, no action going on that front. And I'm seeing a lot of like millions of dollars being used by the government and to a fucking one main mental health service resource of Australia, when there's plenty. They are getting a huge share of the pie, and really I'm not going to mention who they are, because there are actually some great things about this particular, I'm going to call it not even an organisation, I'm going to call it a freaking mental health entity, presence in Australia, that has somehow been really clever at marketing and gaining a huge stakehold of the portion of the funding, because what they're claiming to do is basically solve youth mental health. So that's a big investment for government, because we need to keep the youth, future voters and future generations of this country mentally well enough to cope with the future ahead. And I support that. I support funding youth mental health. But when youth mental health gets hundreds of millions, and domestic violence and Aboriginal suicide and Aboriginal mental health get fucking tiny crumbs of scraps of funding, when this group of people have seriously severely low health outcomes, and in a crisis point in terms of their health. 1 in 3 Aboriginal men aged 30 years old, 33% of Aboriginal men aged in their 30s will die from suicide. Okay, so like 1/3. So if you're an Aboriginal man in your 30s, you've got a 30% chance of dying from suicide. So like that's what I'm talking about, is a national health crisis, and not to mention the intergenerational trauma from generation to generation from the stolen generation. This is basically, I could go on, but you get the idea that they come. The health outcomes weren't great anyway. Now, they're in a health system that is so fundamentally fucked up and flawed, with every single person not wanting to take accountability and passing the buck and getting fucking away with it. No empathy, racism, stereotyping, discrimination, laziness, incompetence, disorganisation, and just simply people not giving a fuck. Like going to work, clocking off, whatever, not my problem, sort of attitude. And, and the corruption from the people, the white collars, and then keep going past the policymakers, and you get to the fucking parliamentarians and the government and the politicians, and you can just see what's happening up there with all the disgusting behaviours and rapes and cover-ups. So I mean, it's just no wonder. Like it's starting from the top and trickling down to the and to the people at the bottom of the health outcome pile, such as like Aboriginal elderly living with multiple chronic conditions, needing life-saving equipment and adequate, proper care, are suffering the most from this fucking flawed health system, when they the ones that need the most at least adequate services and help. Now, like the majority of people that don't really understand Aboriginal health problems, or aren't facing it every day, or know Aboriginal people personally, most people in this country will tell you that, they just love to get handouts. They're just bludgers, and they just keep complaining they should just get over it, and just they get chucked money and funding all the time. What are they complaining about? It's not actually as simple as that, mate. So it's a bit more complex, and I don't have time to go into it and explain it in this video, but I want to start a discussion for people and family members of people who have a sick elder, Aboriginal or not, okay? This isn't just, I'm not going to discriminate, like anyone who's Australian, basically. That means you're living here and you call this place home, but there's also sovereignty and Commonwealth and patriotism and pride for your country is involved in that. I took the pledge when I became an Australian citizen in 2017, and I felt very proud to do that. This place has been my home for 21 years, and I'm not going to leave it, and I care about the people in it or the people in my vicinity, in my community. So yeah, I am proud to be living in this country and be called Australian. But when I took an oath to adhere to my responsibilities as an Australian citizen, I expected that people from top level, government politicians, service workers, police officers, nurses, doctors, all of it, I expected them to also follow through on their obligations and responsibilities. And I don't see a whole lot of that, to be honest. And I'm not saying I'm amazing and I'm better than everyone and I've got this moral code. I'm not. I'm just a normal worker trying to go to work and do a good job. And yeah, I'm pretty harsh on myself, and I am disappointed again and again and again and again and again and by other health people, services, organisations that are just, I mean, they're not obviously not all like this. Like, I'm discovering, like, there's more, you know, uncovering the layers and learning, and they all begin well and start off well with the idea and the passion and the purpose, but the good workers get moved up the ladder to the bureaucratic level and taken out of the field, and they think, oh, great career progression, and I get more pay, and like they're telling me I'm going to be amazing, I'm going to make bigger impact from this corner in the office, blah blah blah. But what all that happens is that those people are removed from front line, and slowly, probably they could be more proactive to prevent this, I'm guessing, but slowly they become disconnected and what's the word I'm looking for? They become they become detached from seeing it face to face and helping and doing a good, like the humanity of the job. They start to lose the humanity because they start to lose touch. They start to lose touch with the people and the issues and the purpose of what it was all about, and they start to become. They get turned into from the system, little pencil pushing, laptop writing, techno admin, fucking, stressed out people just trying to cope in a freaking flawed system that they they obviously just spend most of their time managing shit that has nothing to do with taking care of people. It has to do with taking care of the organisation and making sure that the organisation is compliant, and if they're all ticking off all their requirements in the time that they need to, and that it's basically covering their asses on that takes up more time for them. So and then they start to just become totally over it and lose the purpose of what they wanted to do this job for in the first place. And we just get churned into this washing machine of bureaucratic bullshit and passing the buck and nothing getting done. And this is what I'm witnessing anyway. So I don't ever want to work in the freaking office level of health ever. I don't even want to be a nurse anymore sometimes. Like, why? So I can sit there most of my time filling out freaking paperwork charts and giving people medication for chronic conditions. Like, Western medicine has freaking no place in chronic health. Like, go to a Chinese doctor, go to a naturopath, go to a kinesiologist, go to a freaking chiropractor, go to a dietitian, go to a gynecologist, go to a specialist, go to endocrinologist, go to an optometrist, go to a dentist. You go to the specific area of health that you want to go to, and depending on how much money you make, you can get adequate care, good care, or shit care. It's been monopolised and commoditized, and it's just totally actually doing more harm than good. I'm seeing more people come out of hospital or with more damage to them psychologically and physically than when they went in. I'm seeing, I'm meeting people who have been on medication long term by a GP who didn't research the medication or the patient enough. So that it's like, instead of diagnosing the whole problem, they're just like solving a little symptom, like a band-aid. Oh, you've got this problem? Oh, take these pills. Oh, well, now this new problem's developed because of why? Because of the pills. Oh, try these ones then. Oh, but you need to take them with this one in the morning, but don't take that one at lunchtime. But you've got to take this one with food. But make sure you don't have alcohol with this one, and don't mix this one with your antidepressants, because we're all on fucking antidepressants now. So we're just like, none of what is happening is, it just feels like it's spiraling out of control and disintegrating and falling apart. And it's only going to get worse as the population grows, and the restraints and legal compliance, safety standards getting way fucking out of hand and unreachable, meaning we are just spending our time doing this. Like, jump, you know, I don't know. I don't even want to think about what it's like to be at that level. I just want to work one-on-one with people. I want to help each situation that comes my way. I hope that I try my best in that situation to get a problem solved or finish the job, or make the person feel listened to, cared for, help them as much as I can with the limited knowledge that I know, and come home and have a scotch and a cigarette and vent to my poor boyfriend about it, and hope that tomorrow will be better. And I'm just wanting to know if anyone else out there who's a health worker or a family who've got their stories, we could please start to have a huge discussion. Now is the time. Truth is starting to come out now. These are the days for that. Look at the Women's March and the climate change and like Black Lives Matter movement. Everyone's getting their go. So let's go. Let's do this, because this is our future health system, and I'm going to be a participant of it as I age, and my children are going to be no doubt needing to get medical treatment at some time in their lives. All of us will. So this is all of our problem, to like recognize what's going on and just basically say, like, we won't accept this, and enough is enough. So stop hurting us and misdiagnosing us and giving us pills that aren't helping us, okay? Because it's fucking bullshit. And I'd like to connect with other people who feel the same way, because I'm feeling like quite isolated and lost, like, because I'm not seeing other workers. I mean, I do, the occasional excellent specialist will pop up that I think, yeah, great, you know, but like majority, I'm not really meeting other people that like care, like they probably know about it, but like not really caring as much. So I'd like to connect with those people just for my own freaking knowledge and well-being. And stay tuned for more videos. Bye.